Pediatrics for 8th semester students of the Faculty of Medicine. Pediatrics. Pediatrics is the branch of medicine that focuses on the health of children, from newborns to adolescents. In the 8th semester of medical school, students typically learn about various aspects of growth and development in children, as well as the diagnosis and management of diseases commonly found in children. Below is a detailed explanation of the material covered in pediatrics in the 8th semester. 1. Definition and objectives of pediatrics. Pediatrics is a medical discipline that focuses on child health, including prevention, diagnosis, treatment, and management of various diseases that arise during the growth and development stages of children. The main goal of this field is to provide knowledge on how to maintain and improve children's health to enable optimal growth and development. 2. Key aspects of pediatric health. In the 8th semester, students will study several key aspects, including growth and development of children, understanding physical, motor, cognitive, and social growth patterns. This includes monitoring weight, height, and psychosocial development in children according to their age stages. Vaccination, immunization programs are essential in preventing diseases in children. Students learn about various types of vaccines, the timing of vaccine administration, and the challenges and importance of vaccination. Child nutrition. Understanding the nutritional needs of children at different ages, as well as how to address nutritional issues such as malnutrition, obesity, and eating disorders. Disease prevention. Preventing diseases that affect children, including those preventable through vaccination, hygiene, and healthy lifestyles. 3. Common diseases in children. In the 8th semester, students will also learn about various diseases that commonly affect children, such as 3.1 infectious diseases in children, upper respiratory tract infections, URTI, common causes of cough, colds, and fever in children, often caused by viruses like influenza, rhinovirus, or bacteria such as Streptococcus pneumoniae. Pneumonia, infection of the lungs that causes symptoms such as cough, shortness of breath, and fever. Diagnosis is done through physical examination, chest X-ray, and laboratory tests. Diarrhea, a leading cause of death in children, often caused by bacterial or viral infections. Treatment includes oral rehydration and antibiotics if needed. 3.2 Developmental disorders and metabolic diseases. Developmental disorders. Conditions such as autism, speech delay, and other behavioral issues. Metabolic disorders. Conditions like phenylketonuria, type 1 diabetes, and congenital hypothyroidism. 3.3 Cardiovascular diseases in children. Cardiomyopathy, a condition affecting the heart muscle, which can impact cardiac function in children. Congenital heart disease. Conditions present at birth, such as ventricular or atrial septal defects. 3.4 Rheumatologic diseases in children. Juvenile idiopathic arthritis, an autoimmune disease causing joint inflammation in children. Rheumatic fever, a condition caused by streptococcus infection, leading to inflammation of the heart, joints, and skin. 3.5 Kidney diseases in children. Urinary tract infection, UTI, infections that can cause fever. Painful urination and kidney dysfunction in children. Acute kidney failure, a condition where kidney function suddenly declines in children, often due to dehydration or severe infection. 4. Clinical approach to children. In the 8th semester, students are also trained to develop clinical skills in treating children, which includes anamnesis and physical examination of children. Techniques for interviewing parents and examining children in a safe and comfortable manner. Family interaction. Students are taught to communicate with families of children, including providing education on diseases and home care. Follow-up care for children. Developing care plans that include treatment, developmental monitoring, and future disease prevention. 5. Clinical cases in pediatrics. Neonatal cases. Managing newborns who require special attention, such as asphyxia, neonatal infections, or congenital anomalies. Malnutrition cases. Addressing issues of malnutrition in children, whether undernutrition or obesity. Infectious disease cases. Managing cases of infectious diseases in children, such as measles, polio, or gastrointestinal infections. 6. Learning components. Pediatrics learning in the 8th semester includes theory classes, covering the pathophysiology of diseases in children, diagnosis, treatment, and prevention. Practical sessions. Students participate in physical examinations of children, laboratory sample collection, and diagnostic tests. Simulations and clinical observation. Students interact with children or patient models to hone their clinical and communication skills. Case discussions. Discussing real or simulated cases, including planning diagnostic steps and treatment. 7. Ethics and communication in pediatrics. It is essential for students to understand medical ethics related to pediatric patients, such as issues regarding parental or guardian consent for medical procedures and ensuring the comfort and safety of children during medical care. Pediatrics in the 8th semester aims to provide students with a deep understanding of various diseases affecting children and the skills to manage young patients with a compassionate and competent approach.